speaking, we will have the lines muted to reduce unnecessary noise, but I invite you to please use the chat box throughout the presentation, and we will unmute the lines at the end of the presentation, and would love to hear comments from you. So I'm going to turn it over to Dr. Lisa Letourneau, our physician consultant and moderator, to introduce our speakers for today.
Great. Thank you so much. This is Lisa Letourneau with ABIM's Choosing Wisely initiative, and we're very happy today to have Randi Redmond Oster as our speaker today. Randi is the multi-award-winning author of Questioning Protocol, a tool that helps patients navigate the healthcare system and medical professionals understand the patient perspective, and that's really her strong area of experience. She's a nationally acclaimed speaker on healthcare reform, shared decision-making, and patient engagement. She's also teamed up with leaders working in organizational cultural transformation to found a business called Help Me Help, a business that's focused on training frontline staff in healthcare to improve the patient experience. She serves as president of Help Me Help and has led the team there to deliver a program recognized as a key quality initiative that's helped a national health plan earn a 4.5-star rating from the National Committee for Quality Assurance. She's also the FDA consumer representative for their Pediatric Advisory Committee for Drug Approvals, and she's a founding member of the Right Care Alliance, the Patient Experience Policy Forum, and the Patient Safety Action Network. So clearly brings a tremendous wealth of experience on this front of patient experience, and she's going to be talking to us about improving physician and patient relationships. So with that, Randi.
So thank you. Thank you, first of all, for having me. And today I am going to talk about what patients want. But I know and I believe that the people on this call know that each of you can think about a time where you really helped a patient and made a difference. And I'll also say that not just one, but over and over and over again. And I'd like for you to take a moment to think about one time where you felt you made that difference and how you felt and what that did for the way you went home that particular evening. Because today, what I am going to focus on and what I want you to be able to walk away with is to learn how to scale it, how not to have it just one time or an off time, but to make it consistent and to know that there's a way to do this, that you don't need checklists. So I come to you just a little bit of background. My son has Crohn's disease. He ended up in the hospital, and we were given a hospitalist. They didn't know what my son wanted, who he was. He ended up getting drugs that he didn't want to take, that his doctor wouldn't have given to him. And we were lost, scared, and confused. And what the people in the hospital didn't know was that my background came from industry. It came specifically from aerospace, and that I was a process expert, and that it became my mission to help improve the patient experience. And so I was fortunate to, with that mission, team up with leaders in the United States on cultural change and how do other industries do this, and what are the best practices that can be used. And so today I'm going to unveil this. I'm going to share with you the secrets and help you take what you do and make it permeate throughout your organizations, because I believe the people on this call that are taking their time today are champions. You're champions because you're interested for yourself and you're interested for those that you work with. So I have 3 objectives today. The first one is to understand how the patient experience was designed into your current processes. And then I'm going to take you and delve deeper into our research, which is what do patients want, and then how we took that research built a workshop, rolled it out, and tested it to see the impact on healthcare teams. That's everyone from the person who answers the phone, to the nurse, to the doctor, to the person who takes the copay, and share with you the case study of when this workshop was implemented and what the results were and what the implications can be for organizations. And just as specifically, what I'm going to do is take the time to show you how the choosing wisely questions are such a key tactic that enable the delivery of what our research showed on what patients want. And so I'm going to go quickly. We'll take questions at the end. And what I hope is you'll walk out of here going, oh, it is scalable, it is easy to implement, and there is a way to engage not only myself but my team to deliver for the patient and for us. So I hope you're ready. We don't have any way to do polling, and I can't see your eyes, but I'm going to assume you're ready to get started. So oh my goodness, how many of you, and I know this, CAPS, right? You're measured to patient satisfaction. And what Dr. Lee has said is that two people who receive the exact same care but who have different expectations for how that care is supposed to be delivered can be given different satisfaction ratings because of their different expectations. And you're measured on this, right? How are you supposed to have high satisfaction ratings when it's so subjective? And so the challenge is to understand that patient satisfaction is a component and the end result of the patient experience. And the patient experience is a process, and it requires an understanding of what patients are going through on their journey. And their journey starts with that first phone call to make the appointment, to the time they're in your parking lot, to the time that they're walked to the room to see the doctor. And that whole experience is what comprises at the end when they give their patient satisfaction metrics. And it's not something we can just check off. We have to build it into what we're delivering beyond just that clinical encounter with the doctor. And so I'll share with you, last week, my mother, who's 91, lives with me. She's lived with me for 20 years, and at 91, yes, I take her to the doctor frequently. Last week I'm at the doctor. They're in a new facility, and the nurse is literally trying to shift her little walker with me in the room, and the nurse says to me, I don't know who designed this. It's a gorgeous building. We finally get in here, and the rooms where we have to actually take the blood pressure and the blood work, could you see a smaller room? And you can see it's difficult for me to find a place to sit, and it's difficult for my mother then to maneuver. And then she has to go to the bathroom, right, in the little cup. And the bathroom is like far away, and the nurse is just frustrated. And the reason for this is, who designed it? She kept going, who designed this? And so you know this, we know this, it's inside-out thinking. Leadership is looking at the bottom line. They're looking at what's driving the metrics to get to the bottom line. And then the user experience, we are workarounds. and so in order for the patient satisfaction scores to be what they are, to look at that journey, how do we re-engineer, redesign that experience so that it meets the expectations that will drive the results that at the end of the day the leadership is looking at? And so here's the good news. The current design practices, there is evidence that starts to show there are ways that we can improve the design experience by looking at things like employee engagement. So when that nurse was aggravated because it was hard for her to then walk with my mother who's 91, and you can imagine the bathroom, it felt like it was in Alaska. It turns out that the quality of patient experience is strongly linked with employee engagement. This is evidence-based data, and employee engagement is not defined as something that's hard for us to understand. It's literally, do I like working here? Would I have my family come to this hospital, come to this practice? Do I feel like I'm being heard? Am I a part of a team? And you can start to see just in this little story with my mother that that nurse who had every right to be frustrated, it sort of was sending a message to me about the experience my mother was going to get. Nothing to do with how the doctor was going to treat it. It was part of the entire journey. And therefore, when you look at the next evidence-based point, which is that high employee and physician engagement correlates to higher scores on CAHPS surveys, yeah, I was starting to be with that nurse going, what's going on here? If they didn't even design the room correctly, and it was putting a little bit of doubts in my mind, which, again, expectations is what delivers satisfaction. So what they've also found is not only does it engagement affect your expectations or your CAHPS surveys, but guess what? It also has correlation to outcomes such as lower readmission rates, infection rates, all that stuff that we really want to have happen. And so when we start to look at the design, which was designed for hitting bottom line, or it might feel that way, what we do know and what we see is that the research really shows that engaged employees improve the patient experience and deliver positive outcomes, and they're tied together. And that starts to be the secret of how we can start to look at what we're already doing and find some process improvements. So if you think about dominoes and you line them all up and you hit one and they all start to fall, imagine that chain reaction. What is the chain reaction that we can mimic in healthcare? The end result, improved patient satisfaction scores and health outcomes, is where we're aiming to. But what are the links? What are the steps before that get us there so that just like when you hit the domino, it just goes, and you don't have to think about it? We can do in healthcare. And what we have found, what I'm going to be unveiling to you today, is what that link is. From our research, it starts with the patient I want. I will share with you the key there. But what we have found and what evidence has shown is that when you understand what the patients want and your employees and your healthcare workers are made aware, this triggers an awakening through your organization that then sets a mindset that improves employee engagement. It inspires discretionary effort to implement the ideas that they come up with, which then drives the implementation of these ideas, and we now know improves patient satisfaction scores and health outcomes. It's a wow, and today you're going to learn the steps to get you to where you need to be. One of the things that we hear is many times the doctor will say, I have to do what the patient wants because I'm going to have the patient satisfaction score and it affects me. And so what we also know is that the facts are showing that the patients are not unhappy with the clinical care. The clinical care is delivering what they want, what their expectations are. It's the other stuff. 96% of the complaints are customer service. And when they're posting harsh reviews, it's about inadequate communications and disorganized operations. And so I remember a CMO of a major organization said to me, he said, I was looking up this doctor, and the first thing that came up was his Yelp reviews. And I was reading the Yelp reviews, and they were complaining about the office staff and about the payments. And he goes, I don't understand why this doctor's not firing his staff. Okay, so from my perspective, no. No, we have to improve the processes. How do you build consistent processes so that the doctor is supported, the clinicians are supported by the rest of the team? And in order to do that, we have to look at the journey from the patient point of view, from the parking lot, from the time they come to the receptionist, from the time they make the copay. And that entire experience is what drives the overall satisfaction rating. Oh, there we go. So you're talking to a woman who was in industry, who's aligned now with a team of experts who have helped many different industries design their entire processes to deliver the results that allow them to have high satisfaction ratings. And when we think about organizations, and you think about getting a cup of coffee at a McDonald's or a cup of coffee at Starbucks, you can pay two different price points and your expectations are met. When you think about how other organizations meet those expectations and get the satisfaction ratings, it has nothing to do, and what we're not focused on anything medical. We're not. What we know is that if you understand the emotional end frame, how patients or customers want to feel as a result of their interaction with your organization, and you deliver that, that's what increases their satisfaction. So the best practice is not to emotionally connect to the patient, but to understand how the patient wants to feel as a result of the interaction. And when you do that, and not only you know that, but imagine everyone in your organization knowing how a patient wants to feel at the receptionist, on the phone, with the doctor, as they're exiting. And if everyone is delivering on that expectation, the patient, and especially in healthcare, because we know it's not easy. It's not always good news. This is tough stuff. This isn't Disney. We're not going to wow you. This isn't Lexus where you're in a fancy car. But the methodology of understanding how they want to feel is the secret sauce to making sure their expectations are met. And so we did the research. We went out and used the same methodology that's used in other industry, and we went out and asked more than 400 consumers about how did they feel on their journey. How did they feel at each step, and how did they want to feel? We used 4 methodologies. We did surveys, we did focus groups, we did pilot testing with groups of doctors and staff. We also took stories, over 50 stories, and analyzed them. We had professional people who have done this over and over again, and then took a look at what the gaps were, how did they feel, how did they want to feel at each step. And I'm just going to summarize the secret sauce. I'm giving it to you right now, and I'm unveiling it. Here are the 3 things that patients want to feel. Patients want to feel knowledgeable, supported, and comfortable. And I'm going to take a moment just my guess is you're sitting there thinking, yeah, makes sense, right? They want to feel knowledgeable, supported, and comfortable. But imagine, just take a moment before I go into the depths of what those words mean. Imagine now if everyone in your organization sees someone a little bit off, right? Not somebody. It's most probably one of the 3 things, and if you can deliver on that, they'll feel so much better. And so I just want to take a moment for what patients said knowledgeable is, because this does tie to the choosing wisely questions, right? Choosing wisely, as we look at those questions, is all about helping them have the information they need to make informed decisions. And that's what patients want. They want to feel fully informed, and I want to just be careful here, to their ability for what they need to know, right? They also want to feel understood, that they've been heard, and they want to be prepared to make a decision, that they're involved in the process, and that they have that ability to make that decision. In terms of supported, they want to feel taken care of, that they're being held up, and that they're having the weight borne. And many times that comes when we talk about supported, they'll talk about someone who helped them get an appointment if they needed to get rehab, or they'll talk about the fact that there was a wheelchair that they had easy access to, or someone just explained the process to them, and that helps them feel like that they're cared about. And comfortable is pretty much what we all think. They want to feel at ease. They want to feel safe. They don't want to feel that there's aggravating situations, and they literally are physically comfortable. Comfortable, we did not include pain. This is not about pain, but they just feel they can feel relaxed in where they're at. And so it sounds easy, okay? So you know the secret sauce. What do you do with it, and how do we roll it out? And just because we know this, does that change your organization, right? If you just tell, okay, here are the 3 things, everyone go do it, it has to be ignited. How do you get people to take what they already know and implement it? And at the beginning of this call, I had asked you to think about that time where you actually helped a patient. And my guess, and if I could do the poll, I would say how many of it was you probably either helped them feel more knowledgeable, more comfortable, or more supported. And so what we did in order to roll this out is we actually built a workshop. It's based on a learning map, which is what you see in front of you. This learning map is a depiction of the healthcare landscape, and it takes about 2.5 hours for your teams to go through, where we help them go through the patient journey in interactive exercises, and unveil the secret sauce of knowledgeable, supported, and comfortable. And through that, we then ask them to come up with what they can do. This is an adult learning methodology, which instead of giving the checklist, what it does is it helps them from themselves discover what they can do. And the fundamental premise of of Help Me Health and our Chief Experience Officer, Kathleen Cantrell, has been found for many years that people will tolerate the conclusions of others but will act on their own. So for the design of improving the patient experience has to be from within and by sharing what those conclusions are. And so what we actually do is we take them through at the end. People commit. People will actually focus on and say, I know how to make someone more knowledgeable because I can explain to them the process. I know we had in our case, one of our clients wanted to focus on 3 areas: access, how do my patients get care when they need it; communication, because their communication scores were low; and then their office staff were low. And so what we had done is built in cases where they could discuss how do they improve this. And it was fascinating to see how people would come up with these ideas that they could just implement. And one quick one that I'll never forget is the word comfortable. The woman who was the receptionist, it was at a clinic for expectant mothers who were having postpartum depression, and the room happened to be cold and dank and dark. And she said, they need blankets. They need blankets. And so she made a commitment that she was going to get blankets. And when her manager heard that they needed blankets, it was, I'll never forget this, within 10 days, they had, their organization got everyone blankets for the room. And so what we know is if we allow people to understand the true north and give them that opportunity, they come up with the ideas that they can then implement. So now I'm going to just tell you the results of our case study. So we rolled this out, and what we did in our research is we said, let's look at how people feel about their ability to help the patient. And we did a pre-workshop survey. We did a post-workshop survey. We then conducted 30-minute interviews with 12 to 15 participants to start to see where their ideas were, to see if we were really getting an attitude and behavior change. Did we, when we explained the secret sauce, when we gave them the opportunity to implement the ideas, did it work? And so here are the results of our workshops. So basically what we did is we looked at 2 groups, people who attended and people who did not attend. And what we found, and data that's in bold is statistically significant for growth, that's how we are showing it here, is that people who haven't attended the workshop, they have ideas. They have ideas of what they can do, but people who attend the workshop had more specific ideas. They had ideas that were not vague, but very specific, like the woman who said they need blankets. And then what we also looked at is how many of those ideas said the word patient. So once they were focused on this and they knew about the patient, did they even acknowledge that they had ideas for the patient? And what we found was that people who attended naturally had significantly more patient ideas than those who did not attend. And then what we looked at was based on knowledgeable, supported, and comfortable. What was the difference between those who attended and those who didn't attend? And we found that those attendees had, with knowledgeable and comfortable, a significant more number of ideas to make patients feel that way. And what we know is when patients feel knowledgeable, supported, and comfortable, those are the three elements that build, we actually say it this way, that build trust in the organization and that help them understand that their expectations are met. And as we talk about that chain reaction, right, boom, 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 gets to where the leaders want, which are improved outcomes and improved bottom line. We also then went ahead and looked at the areas that this particular client wanted us to focus on because they were very focused on their HCAHPS. And for those of you that know what's in the HCAHPS, but they are measured on access, communications, and office staff. And so we went back and we looked at what are the differences between those that had attended versus not attended. And what we found is that those people who had attended had more ideas for access as well as office staff. And some of the ideas, and I just want to take a moment on one story with access because the way it works is around that learning map that you saw, you'll get 6 to 8 people. It can be everyone from the doctor, the nurse, the person who's in the back room, the receptionist. And I'll never forget this case, which was the doctor was a pediatrician. He always referred his patients to Dr. X. Dr. X had 6 weeks waiting time. You can imagine a mother waiting 6 weeks after she meets this doctor to say now he's going to go get an appointment. The woman who was doing the referrals, her level of paperwork, I looked at her and I said, how much paperwork do you have on my desk? And I think if you could have seen her face, she looked like she was drowning underneath the weight of this paperwork. And the doctor, it was the first time they had sat in a room, like around this little table, and he looked at her and he said, oh my goodness, I could refer to Dr. Y, and I believe his wait time is like a week. And I know Dr. Y, and I'm comfortable with him. I just didn't realize what was happening to you behind the desk, right? And so in that instant, right, imagine the next day when he changed his process, the patient was happier, and the backroom office staff was happier. And so that's when I'm talking about the ideas, right? Where do the ideas come from? It comes from understanding that patients want to feel knowledgeable, supported, and comfortable. And in this case, it was how do we help them have more access and understand that process. I have many, many stories, but I want to be sensitive to time here. So again, an office staff, which because there was such a big, gap, what we found there was they were able to come up with ideas that were in their control. So we talk about policy. We can't change HIPAA, but what can you change? Well, you can change how you explain why we have to support HIPAA, and that helps a patient feel knowledgeable, right? And so what we started to see is those ideas of those people who attended, who understood that patients want to feel knowledgeable, were able to come up with ideas from themselves to help answer the questions that patients want, and they came up with very specific ideas. When we looked at, are you implementing these ideas, right? And understand this is just one 2.5-hour workshop. And so we looked at attendees versus non-attendees. And the first thing we noticed is there wasn't that much of a difference. When we looked at, in general, across, we had done 4 ACOs. So that, at 4 ACOs, in general, there wasn't much of a difference. But there was one ACO which had what we would call a depth, where instead of them just having a couple of people go through the program, they really had they penetrated organizations. And here was where I guess the light bulb went off. People don't need hours and hours and hours of training to be better with the patients. They inherently know and care. This is why they're in the jobs. They don't need checklists. They know, but they just have to be released. It has to be freed for them. And when everyone has that true north, knowledgeable, supported, and comfortable, what we found was 61% of those ideas in that organization were implemented within 30 days. So that's incredible, right? Imagine having the idea, implementing it within 30 days, and then the impact as we think about leading indicators to get to through the chain reaction, the end being improved satisfaction scores, improved outcomes. If you can move forward and up that chain because of engagement, right? And this all ties back to those original data that we know if your employees are engaged, right? The data shows you have better outcomes, better CAP scores. Well, this is when, from that first chart, we said the patient I want is that first step that triggers the dominoes for them to fall. And so it was a wow for us. And it's a wow because I will say, knowing that people want to make a difference, knowing that they can make a difference, and then seeing the energy of even the woman who worked in the back room, talking to the doctor and coming up with solutions, and focused on what the patient wants, was amazing. Not hard. It's within their sphere of influence and their capability. And so when I think about this group, and I think about first of all, we're of like minds, right? The fact that you're here, the fact that you're concerned about the choosing wisely questions, and when we think about these questions about, do I really need this test or procedure? What are the risks? Are there simpler, safer options? What happens if I don't do anything? How much does it cost? Okay, let's just think. This is a tactic behind knowledgeable. And so what I'd love to challenge you is now it's really, when you think about the chain reaction, doing this is really the step of what patients want. It is the step that allows them to have their expectations. And we know that if we meet their expectations, the end results will be, I'm going to say threefold. The patients will feel more satisfied. The outcomes improve. But to me, one of the biggest ones, and the ones that I love, is that the staff, those of you on the phone that are working so hard and delivering with all these initiatives, also have an easier way to build a team and to feel good. So with that, I would love for you to think about how you can incorporate the Choosing Wisely questions and understanding it's part of a bigger cultural frame. And that is why we were asked to speak today, because it is so key to delivery. And I'm willing to I have a couple of moments to take some questions if there are any. And so let me just say thank you for all you do and for all you will be doing.
Great. Well, this is Lisa again. Thanks so much, Randi. And thanks for your very thoughtful walk through some of these big issues. would invite anyone who has a question to either unmute, or you can use the chat function as well. We do have several folks on the call with us, so invite anyone to unmute if they'd like to jump in with a question.
And we have unmuted everyone if they have questions.
Well, I'll jump in with a question. Am I echoing?
Go ahead.
I'll jump in with a question, and if others have some, please go ahead and jump in as well or chat. But in terms of the actual choosing wisely intersection with what you're talking about in terms of helping patients feel knowledgeable, supported, and comfortable, have you had direct experience working with a practice on this, or any particular thoughts on sort of where you get started in terms of the 5 questions or otherwise kind of specific use of the program to get to those aims?
Yeah. So one of the things that I love to do, and I have to say I've been working with Choosing Wisely for many years, and with the cards and handing them out, is, like I said, it is a tactic. It's very important that patients have the ability to understand that it's okay to ask these questions, and they should ask these questions. The leap that I'm hoping that the group here can do is it's not only the questions, which we have to hold on to, but what I'd love for this group to think about is knowing that patients want to feel knowledgeable, supported, and comfortable. What steps can they put into their organizations so that when they're in the waiting room, right, there are descriptions of, let's say, what are these procedures or these tests, or in other words, how do you build it into the patient journey? So to take the Choosing Wisely questions and then to incorporate it into the patient journey at appropriate levels is critical. And so while we haven't done that yet, what I am trying to emphasize is that it's not an isolated point in time, but it's something that you have to look at the journey, and then where does it fit, and how do we continue to provide that education so that they feel even more comfortable. I want to give a quick example, which was I had shown Disney on one of the charts. When you go to Disney and make a reservation, before you come, they mail you, I think, these little bracelets, right? It's Disney band. So why do they do that, right? It's because the journey even starts before you get there. And in that band, they actually are explaining a little bit about, what to expect. And so these 5 questions, do I really need this test or procedure? There is an ability for those on the phone to know they're hearing the same questions over and over again, to find a way to provide that information. So let me give one other specific example. In one workshop, we had the marketing manager. When he understood the struggle the doctors were having with 15 minutes to explain everything, and that some of the information was repetitive, patient to patient, he took the time to do a little pamphlet that is now in their waiting room. So aside from reading Cosmo or whatever those magazines are, there's some more information. That not too much, but enough to answer some questions of, do I really need this test or procedure, right? And so that's the gold standard, to take these questions and think about it in terms of the patient journey. Did I answer your question?
Yeah. I think it's a lot of times comes down to, how does one operationalize it? How do you, sort of run the full spectrum from thinking about the points in the patient journey, from, leadership buy-in in an organization or practice to the frontline staff. So I think those are, good thoughts to help guide thinking about that.
Yep. And I also want to just, how much does it cost? I want to take a little moment to talk about this one.
Yeah, the big one, the hard one.
Well, it's a hard one because here's one. I had a doctor who came up to me and they go, she literally said this. She said, Randi, she said, the patients are coming in. They're coming up to the receptionist and they want to know how much it's going to cost. She goes, she doesn't know how much it's going to cost. I don't even know how much it's going to cost because I don't know what we're going to do yet. So she says one or two things happen. They leave, or they're coming in, we're doing all the work, and then they're not paying, right? And, okay, so that ties into knowledgeable, right? Right? So think about, we think about that chain reaction, and you think about at the end of the day, the patient satisfaction score, which is what the leadership is focused on, ties very much back into how much does it cost, right? And so we can't ignore this, right? Because that patient who walked out, or the patient who then didn't pay, okay, as she was then given the patient, right, her little caps, she's not scoring it well, right? And so I love these 5 questions because they're so critical, but we have to really think about it from the patient journey and know that this is critical to what they need in terms of being knowledgeable.
Agreed. It's a question of how to get that information in a way that's helpful for patients. That seems to be so tough in many practices. But let me turn back to the group. Anyone else with a question on that? Go ahead.
So waiting for people now when you're in. Okay. No problem. You can take them if you want.
I think then I would like to ask a question of the group. When you're looking at your patient experience journey, how would you say it's going, and what would you say the challenges are?
So I think we'll be fine. We said Amanda may be doing something with her sister this weekend, which is just fine.
Anybody want to jump in on that? I don't know. So if you want to let people unmute selectively, there's still a little background noise going on. Oh, it's better. Anybody have thoughts about that? Janice, I'm tempted to call on you. Janice spoke at one of our earlier webinars about the patient experience. Is that fair? Janice, talk to you. Any thoughts from your experience?
Hi, I'm sorry. I didn't realize you were talking to me. I'm sorry. I didn't know if I was the Janice. Yeah, this is, I was really impressed with this. I'm at the PCORI conference right now, so we're talking about storytelling and the importance of, actually, I just left one, which I think is really pertinent to what you're talking about today, which I summed up as the design and the improvement efforts that can be done in clinics and the importance of adding patients and being there in person. And a person was presenting before I just came up to be on the webinar, and she shared about storytelling in her system where they're capturing clinic staff, doctors, physicians, patients, and, just anybody involved with the clinics come in for storytelling. And they, 15 minutes or so, and it's very interesting, the different stories that come, but people find out, something about somebody they didn't know. And I really appreciated, just how you started the whole webinar off about how you took your mother, and the restroom was so far down the hallway. And it's so important to have patients in the design, because so much, and then what, like you mentioned, improvement efforts. You gave the example of the doctor that, there was a 6-week waiting list versus he could get into this other doctor for a week. And if you don't get them all in the same room, at some point in time, and I don't know how we can really improve this in our systems, but beyond any doubt, it's low-value care if we aren't bringing the people together. It's wonderful people at the top, and then the patients also get together, but if you don't have the people, the champions and the frontline staff, some different representation, throughout the year, I don't think that you really will capture the bigger picture. So I just really appreciate what you've done. I'm sorry. I didn't know you were talking to me.
No, that's okay. I do want to take a moment to emphasize what you're saying. Everyone is so busy that you hit the nail on the head. They don't have time to talk to each other. And what we're discovering is when they do have the time to talk about this, they have the ideas. You saw the research, right? People who went through the workshop and didn't go through the workshop, everyone had ideas. But those who had the depth, where enough people went through it, where they understood the same true north, and they were going to the same true north, they implemented those ideas within 30 days. And that's the secret sauce, is that here on this phone call, because I don't want to waste your time. Okay, so knowledgeable, supported, and comfortable. You're data point of one. But imagine if everyone, was working towards that, and they see that patient with that frustrated look in their eye, and they go, oh, you know what? She needs a little more knowledge. What can I do at the reception area to help provide that knowledge? We know the questions that they want to ask, right? I'm staring at them. How do we build that in? And I'm going to tell you, your organizations already know. When they do it, they feel more engaged, and all of those are the leading indicators to get us to where I want to go. But it's taking that, in this case, we did it in 2.5 hours, allowing them to have that time. So I love thank you for sharing that, because it ties exactly to what we've discovered.
Great. Well, thank you very much. Anyone else? Or questions or comments?
And if anyone would want to learn more, talk to me. I believe it's Randi Oster. I'm sure you have my name someplace, but please reach out, because we did do a lot. This is a game changer. It's proven, and it ties into the methodology of these 5 questions from Choosing Wisely. And I just want to thank you for taking the time. And I'm here to help, because this has become my personal mission.
Great. Well, we can certainly hear that personal passion in your talk with us today. So thanks so much, Randi. With that, I will look to wrap us up and turn it back to Kelly.
Great. Randi, I want to thank you so much for sharing your experiences with us today and sharing the research that you've done. And I want to thank everyone for showing up today. Again, just as a reminder, we will also be sharing this recording on Workplace, and we can additionally put Randi's email on there as well if you would like to contact her. If for some reason you are not on Workplace, you can contact Kate Carmody to either join the Learning Network or to just get the recording, and her email is in the chat box. So thank you everyone for showing up today, and we will talk to you next month. Thanks so much.